okay?
Hello?
Hello, my name's Courtney. I'm going to be the nurse helping you today. Can I get your name and date of birth, please?
Haley Antolik, 050499.
Alright, that sounds good. So I recently heard that you were diagnosed with type 2 diabetes.
Yeah.
Is that correct? Yeah? Is that a new diagnosis?
Yeah.
Yeah. But we probably had it for a little while, right?
I guess.
Yes. So type 2 diabetes, it can occur just by insulin resistance, which that means our body gets used to the amount of insulin we have, and it's just not enough to manage the amount of sugar and carbs that we're consuming, so our blood sugar rises up. Or our pancreas, because we age, does not produce as much insulin.
Okay.
So, with this, knowing that it's based off of what we consume, we want to manage our diet. So, do you know any foods that are really high in carbs that you think we should avoid? Or do you need some, guidance with that?
Is bacon?
Bacon, no. So, that's a different thing. Bacon may not have a lot of glucose or sugar in it, but the problem is that it's really high in bad fats because you're cooking it and all that oil and that grease, and that can affect the cardiovascular system, which can affect your diabetes. But we'd want to avoid foods high in unhealthy fats. And so, if you cook in a lot of butter, you might want to replace that with sunflower oil or maybe an olive oil. In addition, you want to avoid things like ice cream or soda or a lot of processed foods, like cakes and most things that contain a lot of sugar.
Okay.
And so the thing is with type 2 diabetes, there are a lot of risk factors that go with it. So age can be one. So approaching your mid-60s, that's when we can start to see the symptoms of that. Poor diet, which you expressed that you like bacon, so that can be a contributor if you've been eating that long through your life, as well as drinking a lot of sugary drinks. And does anyone in your family have diabetes?
My mother.
Yeah, so with relatives that our first degree relatives that have diabetes, that greatly increases our chance to have it. And hypertension and other cardiovascular disease can affect that as well.
Okay. So, this is just kind of how I am, or am I getting medication?
So there are two different types of medications. One is insulin, which is an injection, which we do in subcutaneous tissues, which is our fatty tissue. So what you'd want to do is in your abdomen, probably about 1 inch away from your belly button, you'd want to feel around, and if you feel something that's spongy, you don't want to go there because that's a muscle, and it's going to hurt when you stab it with the needle. So you want to feel for the fat, and then you want to pinch the fat. And so, for example, with this demo needle, you'd clean this off first for about 15-20 seconds with an alcohol swab, and then you'd inject it and hold and let go. But to do that, we need to go based off of our blood sugars, which you should be checking with every meal before every meal. And if you don't feel well throughout the day, then you'd also want to check it. So how you do that is you'd clean off your finger with an alcohol swab for, again, 15 to 30 seconds. And then you take this little push pin needle and you'd poke your finger and milk out the blood. And you'd wipe away the first wipe because that one has the alcohol on it and it can mess up our reading. And the higher the reading, the more insulin you get. So we don't want that, right? So, and then you'd milk out again without poking, and being careful not to touch the tip of your finger. Some more blood, and you'd take your glucose monitor and check it. And if it's really low, you'd want to eat something sugary and if it's really high, you'd want to take your insulin. And then we have oral medications, which you take once a day, usually in the morning, and those last the entirety of the day, and you want to take them at the same time. And if you miss one, take it as soon as possible, unless it's within like 12 hours of your next dose.
Okay.
And then another really important thing is that you maintain an active lifestyle. How active would you say you are?
I go out every once in a while with my dog.
Every once in a while? Okay, well, we should be aiming for at least 30 minutes of exercise a day, 5 days a week. So, you think that'd be an option for you?
Yeah, I guess she needs walked a little more.
Yeah. And another important thing is, do you smoke or drink alcohol?
I have a glass of wine every once in a while.
Well, a glass of wine every once in a while isn't too bad, but it's really important that we avoid smoking or using tobacco at all, like chew, or drinking alcohol as much as possible, because that can affect our levels as well. And losing weight is also beneficial. Do you have any other questions?
So you said that if my blood sugar is low, that I have to drink. What happens if it's too low?
If it's too low, preferably you'd try to call 911 if you're conscious. If not, then you would try to have someone else to call 911 for you, because that can start shutting down your heart and causing a whole event and affecting your level of consciousness, and you may become comatose.
Okay. And what if I have too much sugar, like at a buffet?
So if you have too much sugar, you're going to want to take your level again and give yourself the insulin. But if it's over, let's say about 215, you're going to want to call your healthcare provider and see what they think is best, because they might recommend you go to the hospital or just take your insulin. And speaking of the high and low, there's hypo and hyperglycemia. So hypo is when our blood sugar is a little bit too low, or a lot too low, in that case. And some of the symptoms we can experience with that is changes in our consciousness. So we might be really anxious or irritable, and those are usually the first signs. So if you notice yourself being out of it, then you'd probably want to drink like a glass of orange juice or just have some pudding. Other signs is you'll start to get pale and sweaty as it goes on. And with hyper, it's going to be kind of the opposite. You might still be a little anxious or irritable, but your skin's going to be dry and flushed. So you won't be sweaty, and you're going to be bright red.
Okay.
And you might become lethargic.
Okay.
Do you have any other questions for me?
No, I don't think I do.